Welcome back, everyone. The number of COVID-19 cases is on the rise in Indiana. Yesterday afternoon, the State Department of Health reporting another 1,500 new positive coronavirus cases, bringing the state's total now to more than 149,000. As more people get sick, many are ending up in the hospital. It's a big question. People say, well, are people being hospitalized? And the answer is yes. Joining me live is Dr. Paul Calkins. He's the interim chief medical executive for IU Health. Doctor, good morning to you.
Good morning, Angela.
So good to see you. And so many people are asking us questions every day about this. Can you just describe right now, what is the situation at IU Health as far as the hospitalizations go?
Well, as of yesterday morning, we had 119 patients in the hospital at IU Health, and about 50 those were known positives, and about 50 others who were waiting tests. Compared to September, that's about 50% more than we had last month. So it's definitely an increase.
And when you describe the concern level you have, how do you describe that to people that are watching who may have, said, well, hey, not as many people are getting sick, younger people can handle it better. What do you want them to know about what you see every day?
Well, the first thing I would say is that we did see an increase in the number of 19 and 20-year-olds back when the colleges first opened, but most of those people did not get admitted to the hospital. And it looks like statewide the age distribution has started shifting back towards 40 to 60-year-olds. And so those are the people that we see winding up in the hospital.
And early on, when we were talking about hospitalizations, boy, the news was really big on ventilators. Then we heard more people were using things like doctors were using steroids. There's another piece of equipment we were able to talk about in the commercial break that you guys are also seeing benefit those in the hospital. Can you tell us about that?
So that device is called a heated high flow oxygen device. It's essentially, if you've ever watched people in the hospital on TV, the tubes that are in people's noses, it's a version of that kind of device, and it provides large quantities of oxygen directly to the patient. And it's been useful in many patients that are positive for COVID-19, which has meant that we've really cut down the amount of ventilator use. Back in the spring, about a third of our patients were on ventilators, and right now it's around 10-12%.
I wanted to ask you too, do we have enough of the pieces of equipment that give us the oxygen, for lack of better, me not remembering exactly how to say everything that you know?
We bought a number of extra high flow oxygen devices back in the spring. At the moment, we have about 200 and about 50 of them are in use, but we are still examining that essentially on a daily basis to make sure that we have enough. There are a couple of other things that we can do with some of our existing equipment to provide a similar function. So we think we're good at the moment, but we're keeping a very close eye on that, obviously.
Dr. Calkins, we're out of time. Love talking to you. And we appreciate everything that you're doing to keep us healthy, and we'll continue to try to spread your message to everyone.
Thanks, and get a flu shot, okay?
Okay, flu shots. Flu shots. We'll see you next time. If you would like more information, fox59.com/links.